Heart health is crucial for overall well-being. The heart is an incredible organ that tirelessly pumps blood throughout our bodies, delivering essential nutrients and oxygen to every cell. Without a healthy heart, our bodies simply cannot function optimally. It's the engine that keeps everything running smoothly. Just like a car engine needs regular maintenance and high-quality fuel, our hearts require proper care and attention to keep us going strong. Unfortunately, heart disease is a leading cause of death worldwide. Conditions such as coronary artery disease, heart attacks, and strokes claim millions of lives each year. These diseases often develop silently, without noticeable symptoms until it's too late. The good news is that many cases are preventable with lifestyle changes. Regular physical activity, a balanced diet, and avoiding harmful habits like smoking can significantly reduce the risk of heart disease. Taking care of your heart means taking care of your future. By making conscious choices today, you can ensure a healthier, happier tomorrow for yourself and your loved ones. Small changes can make a big difference. Incorporating more fruits and vegetables into your diet, reducing salt and sugar intake, and finding time for daily exercise can have profound effects on your heart health. Simple things like regular exercise, whether it's a brisk walk, a jog, or a workout session at the gym, can strengthen your heart and improve your overall fitness. And a balanced diet go a long way. Eating a variety of colorful fruits and vegetables, whole grains, lean proteins, and healthy fats can provide the nutrients your heart needs to stay healthy. Prevention is always better than cure. Regular checkups with your healthcare provider can help detect any potential issues early, allowing for timely intervention and management. By taking proactive steps, you can reduce your risk of heart disease. This includes managing stress, getting enough sleep, and staying informed about your heart health. And live a longer, healthier life. Remember, your heart is at the center of everything you do. Treat it with the care and respect it deserves, and it will serve you well for years to come. Let's talk about carbs. Not all carbs are created equal. Refined carbohydrates like white bread and sugary drinks can spike your blood sugar levels. These spikes can lead to inflammation and damage your arteries over time. This damage increases your risk of heart disease. Instead of reaching for processed carbs, opt for complex carbohydrates. These include whole grains, fruits, and vegetables. They provide sustained energy and fiber, which is beneficial for heart health. Remember, moderation is key. Salt can be sneaky. It tastes great, but too much can wreak havoc on your blood pressure. High blood pressure puts extra strain on your heart and blood vessels. Over time, this can lead to heart attacks, strokes, and other serious problems. The good news is that reducing your salt intake is a simple yet powerful change. Read food labels carefully and choose low-sodium options whenever possible. Flavor your meals with herbs and spices instead of relying on salt. Your heart will thank you. Making healthy dietary changes doesn't have to be overwhelming. Start by incorporating more fruits and vegetables into your meals. They are packed with antioxidants and fiber, which are beneficial for heart health. Choose lean protein sources like fish, chicken, beans, and lentils. They provide essential nutrients without the unhealthy fats found in red meat. And don't forget about healthy fats. Foods like avocados, nuts, and olive oil are good for your heart. Section 5. Beyond heart health, the ripple effect of a balanced diet. The benefits of a heart-healthy diet extend far beyond your cardiovascular system. When you choose to eat a balanced diet, you're not just taking care of your heart. You're investing in your overall well-being. A diet rich in fruits, vegetables, whole grains, and lean proteins can have a profound impact on various aspects of your health. Eating a balanced diet can reduce your risk of developing type 2 diabetes. By maintaining stable blood sugar levels through proper nutrition, you can avoid the spikes and crashes that lead to insulin resistance. This means fewer health complications and a better quality of life. It can also improve your cholesterol levels. Foods high in fiber, such as oats and legumes, help to lower bad cholesterol while increasing good cholesterol. This balance is crucial for maintaining healthy arteries and preventing heart disease, and lower your risk of certain types of cancer. Antioxidant-rich foods like berries, nuts, and green leafy vegetables protect your cells from damage. This cellular protection is key in reducing the risk of cancerous growths. When you nourish your body with nutrient-rich foods, you're giving it the tools it needs to thrive. You'll have more energy, improved digestion. A diet that includes a variety of nutrients supports your body's natural processes, making you feel more vibrant and alive. and a stronger immune system. It's a win-win situation. A well-balanced diet provides essential vitamins and minerals that bolster your immune defenses, helping you fend off illnesses more effectively. In the long run, these dietary choices contribute to a happier, healthier you. Section 6. Understanding deadly infections, Pseudomonas, and its impact. While we've been focusing on heart health, it's important to address other potential threats, such as infections. Infections can be just as dangerous, if not more so, especially when they are caused by resilient bacteria. One such bacterium is Pseudomonas, which is notorious for its ability to survive in harsh conditions and resist many common antibiotics. Among them is Pseudomonas, a type of bacteria that can cause a range of infections. This bacterium is particularly concerning because it can thrive in various environments, from soil and water to hospital settings. Its adaptability makes it a formidable opponent in the fight against infections. These infections can affect various parts of the body, including the lungs, urinary tract, and wounds. For instance, in the lungs, Pseudomonas can lead to severe pneumonia, especially in patients with chronic lung diseases like cystic fibrosis. In the urinary tract, it can cause painful and recurrent infections that are difficult to treat. People with weakened immune systems are especially vulnerable to Pseudomonas infections. This includes not only the elderly, but also patients undergoing chemotherapy, those with HIV/AIDS, and individuals who have undergone organ transplants. Their compromised immune systems make it harder for their bodies to fight off these infections. These infections can be serious and even life-threatening if not treated promptly and appropriately. In severe cases, Pseudomonas infections can lead to sepsis, a life-threatening condition that occurs when the body's response to infection causes injury to its own tissues and organs. This underscores the importance of early detection and treatment. Understanding the risks and prevention strategies is crucial. Preventative measures include proper hand hygiene, sterilization of medical equipment, and careful monitoring of patients at risk. By staying informed and vigilant, we can better protect ourselves and our loved ones from the dangers posed by Pseudomonas and other harmful bacteria. Section 7. Prevention is key strategies for staying healthy. Preventing infections like those caused by Pseudomonas involves a multifaceted approach. Good hygiene is paramount. Wash your hands frequently with soap and water, especially after using the restroom and before handling food. If you have any cuts or wounds, keep them clean and covered to prevent infection. It's also crucial to be cautious in healthcare settings. If you're visiting a hospital or clinic, don't be afraid to ask healthcare providers if they've washed their hands. Section 8. Empowering yourself, making healthy choices every day. Ultimately, taking control of your health involves making conscious choices every day. Embrace a healthy lifestyle that includes regular exercise, a balanced diet, and stress management techniques. These choices not only reduce your risk of heart disease, but also boost your overall well-being and protect you from other health threats. Remember, small changes can lead to significant improvements in your health and longevity. This is why you need to know about heart attacks. It could save a life. Here's what you need to know. A heart attack happens when blood flow to the heart is blocked. This often occurs because of a buildup of fat, cholesterol, and other substances. The symptoms are crucial to recognize chest pain or discomfort, shortness of breath, and feeling weak or lightheaded. Sometimes there's pain in the arms, back, neck, or jaw. If you see someone with these symptoms, don't wait. Call emergency services immediately. While waiting for help, keep the person calm and seated. If they're unconscious, start CPR if you're trained. Remember, acting fast can save a life. Know the signs and be ready to help. Stay heart smart. Gallstones are small, hard deposits that can form in your gallbladder. The gallbladder is a small, pear-shaped organ located under your liver. It stores bile, a digestive fluid produced by your liver. Gallstones form when there's an imbalance in the substances that make up bile. Cholesterol is a common component of gallstones. Sometimes bilirubin, a pigment in bile, can also contribute to stone formation. The size of gallstones can vary significantly. Some are as small as a grain of sand, while others can grow to the size of a marble. Most people with gallstones don't experience symptoms. However, problems arise when stones block the flow of bile from the gallbladder. When a gallstone obstructs the bile duct, You may experience sudden and intense pain in your upper right abdomen. This pain, known as a gallbladder attack, can last for several minutes to several hours. Other common symptoms include pain that radiates to your back or right shoulder blade, nausea and vomiting, especially after a fatty meal, indigestion and bloating, and yellowing of the skin or whites of the eyes, known as jaundice. If you experience symptoms of gallstones, it's important to see a doctor. They can diagnose the condition and recommend appropriate treatment. For asymptomatic gallstones, watchful waiting is often the preferred approach. This means monitoring the situation and intervening only if symptoms develop. If you have frequent or severe symptoms, your doctor may recommend surgery to remove the gallbladder. This procedure, called a cholecystectomy, is usually performed laparoscopically, using small incisions. While gallstones themselves are usually not life-threatening, they can lead to complications if left untreated. One potential complication is acute cholecystitis, which occurs when the gallbladder becomes inflamed due to a blockage. This can cause severe pain, fever, and vomiting. Another possible complication is pancreatitis, an inflammation of the pancreas that can be triggered by gallstones blocking the common bile duct. Cholelithiasis is the medical term for the presence of gallstones. It's often associated with conditions like obesity, diabetes, and high cholesterol. While frequent burping itself is not directly caused by gallstones, it can be a symptom of indigestion, which may be triggered by gallbladder problems. Early detection and treatment of gallstones are essential to prevent complications. If you experience any symptoms, don't hesitate to seek medical attention. High blood pressure means your blood pushes too hard against your blood vessel walls. Like a garden hose with too much water pressure, this strain can cause damage over time. This damage increases your risk of serious health problems like heart attacks, strokes, and kidney disease. Many things can contribute to high blood pressure, including genetics, lifestyle choices, and underlying medical conditions. It's often called a silent killer because it often doesn't have noticeable symptoms, making regular blood pressure checks crucial. A hypertensive crisis is a sudden, dangerous spike in blood pressure. It's like a balloon about to burst. This requires immediate medical attention. During a hypertensive crisis, you may experience severe headache, dizziness, vision changes, chest pain, or shortness of breath. If you experience these symptoms, call emergency services immediately. Ignoring these signs can lead to organ damage. Resistant hypertension means your blood pressure remains high despite taking at least 3 different blood pressure medications as prescribed. This can be frustrating, but it's important to remember you're not alone. Several factors can contribute to resistant hypertension, including genetics, lifestyle choices, other health conditions, and even the way certain medications interact. It's crucial to work closely with your doctor to identify the underlying causes and find the most effective treatment plan. While some factors are beyond your control, healthy lifestyle choices significantly lower your risk of high blood pressure and its complications. Eating a balanced diet low in sodium and saturated fats, exercising regularly, maintaining a healthy weight, managing stress, and limiting alcohol intake are essential steps. Treating high blood pressure often involves a combination of lifestyle changes and medication. Your doctor will determine the best course of treatment based on your individual needs and risk factors. Remember, managing high blood pressure is a marathon, not a sprint. Be patient, work closely with your doctor, and celebrate your successes along the way. Diabetes is a chronic condition affecting millions worldwide. It disrupts how our body uses glucose, a type of sugar that serves as our primary energy source. When we eat, our body breaks down carbohydrates into glucose, which then enters our bloodstream. This triggers the pancreas to release insulin, a hormone acting like a key, allowing glucose to enter our cells for energy. In diabetes, this process goes awry. Either the pancreas doesn't produce enough insulin, or our cells become resistant to its effects, leading to elevated blood sugar levels. Persistently high blood sugar can lead to various health complications, impacting our eyes, kidneys, heart, and nerves. Understanding the different types of diabetes is crucial for effective management and treatment. Type 1 and Type 2 diabetes are the most common forms, each with distinct characteristics. Type 1 diabetes, often diagnosed in childhood or adolescence, is an autoimmune disease. Here, the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. As a result, individuals with type 1 diabetes produce little or no insulin, requiring lifelong insulin injections or pump therapy to manage their blood sugar levels. Type 2 diabetes, the more prevalent form, typically develops in adulthood. While genetics and family history play a role, lifestyle factors like obesity, physical inactivity, and an unhealthy diet significantly contribute to its development. Unlike type 1, individuals with type 2 diabetes initially produce insulin, but their cells become less responsive to it, leading to a condition called insulin resistance. Insulin resistance is a key feature of type 2 diabetes. Imagine insulin as a key, and our cells as houses with doors that need unlocking for glucose to enter. In insulin resistance, these locks become rusty and the key, insulin, struggles to open the doors, leading to glucose buildup in the bloodstream. Several factors contribute to insulin resistance, including excess body fat, especially around the abdomen, chronic inflammation, and genetic predisposition. As the body tries to compensate for insulin resistance, the pancreas works overtime to produce more insulin. Over time, this constant overproduction can exhaust the insulin-producing cells, leading to a decline in insulin production, further exacerbating high blood sugar levels. Insulin-like growth factor 1, IGF-1, is another hormone playing a crucial role in growth and development. Interestingly, IGF-1 and insulin share structural similarities and can bind to each other's receptors, albeit with different affinities. While IGF-1's primary role is in promoting growth, particularly during childhood and adolescence, it also influences glucose metabolism. High levels of IGF-1 have been linked to increased insulin resistance, potentially contributing to the development of type 2 diabetes. The relationship between IGF-1 and insulin is complex and still being fully understood. However, maintaining healthy IGF-1 levels through lifestyle modifications, like exercise and a balanced diet, may play a role in improving insulin sensitivity and managing type 2 diabetes. Naegleria fowleri is a tiny amoeba, a single-celled organism that lives in warm fresh water. It's so small you need a microscope to see it. But don't let its size fool you. This amoeba can be very dangerous. It's often called the brain-eating amoeba. This scary nickname comes from its potential to cause a rare and deadly brain infection. The infection is called primary amoebic meningoencephalitis, or PAM. PAM causes the brain to swell. Sadly, this infection is almost always fatal. The good news is that Naegleria fowleri infections are very rare, but it's still important to understand the risks and how to protect yourself. Naegleria fowleri thrives in warm freshwater environments. Think lakes, rivers, and hot springs, especially during the hotter months. It can also live in poorly maintained swimming pools and warm tap water. The amoeba has 3 life stages: cyst, flagellate, and trophozoate. The cyst is a dormant, protective stage. The flagellate stage allows it to move around in the water. The trophozoite is the active, feeding stage that can infect humans. Naegleria fowleri infection is rare, but it's crucial to recognize the symptoms. Early symptoms often appear within 1 to 9 days after exposure. They can include headache, fever, nausea, and a stiff neck. Later stage symptoms can be more severe. They include confusion, hallucinations, seizures, and coma. If you've been swimming in warm fresh water and experience any of these symptoms, see a doctor immediately. Tell them about your swimming activity. The good news is that there are ways to minimize the risk of Naegleria fowleri infection. Avoid swimming in warm freshwater lakes and rivers, especially during the hottest times of the year. If you do choose to swim, consider using nose clips or keeping your head above water. Never stir up sediment at the bottom of lakes or ponds. Make sure swimming pools are properly maintained and disinfected. Use boiled or distilled water for nasal irrigation. By understanding the risks and taking simple precautions, you can enjoy water activities while staying safe. The discovery of antibiotics revolutionized medicine. Diseases once considered death sentences became treatable. However, this victory was short-lived. Microbes, the microscopic organisms that cause these diseases, are incredibly adaptable. They evolve rapidly, developing ways to survive even in the presence of drugs designed to kill them. This phenomenon, known as antimicrobial resistance, has given rise to a new threat: superbugs. Superbugs are strains of bacteria, viruses, fungi, and parasites that have become resistant to multiple antimicrobial drugs. This resistance makes infections much harder and sometimes impossible to treat. The once easily treatable infections are becoming deadly again. We are on the cusp of a post-antibiotic era, where even minor injuries and common infections could become life-threatening. The rise of superbugs is a global health crisis. Each year, millions of people worldwide are affected by drug-resistant infections. Thousands die as a result of these untreatable infections. The threat of antimicrobial resistance extends beyond individual health. It has far-reaching economic and societal implications. The fight against superbugs is a race against time. As microbes evolve, we must develop new strategies to stay one step ahead. This involves a multi-pronged approach, developing new antibiotics, exploring alternative treatments, understanding the drivers of resistance, and promoting responsible use of antimicrobials. The discovery of penicillin in 1928 by Alexander Fleming marked a turning point in human history. This miracle drug ushered in a new era of medicine. Bacterial infections, once a leading cause of death, became treatable. Penicillin and subsequent antibiotics saved countless lives and transformed healthcare. However, the effectiveness of antibiotics was not to last. Even as early as the 1940s, scientists began observing the emergence of antibiotic resistance. Bacteria, with their rapid reproduction rates and ability to share genetic material, were quickly adapting to these new drugs. Over the decades, the overuse and misuse of antibiotics have exacerbated the problem. The widespread use of antibiotics in agriculture, particularly in livestock, has further fueled the development of resistance. Antibiotics are often used not to treat infections, but as growth promoters in livestock. This practice creates a breeding ground for drug-resistant bacteria, which can then spread to humans through consumption of contaminated food or contact with animals. The more we use antibiotics, the more we drive the evolution of resistance. This is a classic example of natural selection. When bacteria are exposed to antibiotics, the susceptible ones die off, while the resistant ones survive and multiply. Over time, this leads to the emergence of populations of bacteria that are highly resistant to multiple drugs. The rise of antibiotic resistance is a stark reminder that we are engaged in a constant arms race with microbes. To stay ahead of this threat, we must develop new antibiotics and explore alternative treatment strategies. We must also address the root causes of resistance, such as overuse and misuse of these life-saving drugs. The World Health Organization has identified antimicrobial resistance as one of the top 10 global health threats facing humanity. The numbers are alarming. Current estimates suggest that drug-resistant infections are directly responsible for over 1 million deaths annually. This number is projected to rise dramatically in the coming decades, potentially surpassing deaths from cancer by 2050. The impact of superbugs is felt worldwide, but some regions are disproportionately affected. Low and middle-income countries, particularly those in South Asia and Sub-Saharan Africa, bear a significant burden of drug-resistant infections. Limited access to healthcare, inadequate sanitation, and overuse of antibiotics in agriculture contribute to the high rates of antimicrobial resistance in these regions. The economic consequences of antimicrobial resistance are also staggering. Untreated infections lead to longer hospital stays, increased healthcare costs, and lost productivity. The global economy could lose trillions of dollars annually by 2050 if effective measures to combat antimicrobial resistance are not implemented. Beyond the devastating human and economic costs, antimicrobial resistance poses a threat to modern medicine. Many medical procedures, such as organ transplants, chemotherapy, and major surgeries, rely on the effectiveness of antibiotics to prevent infections. The rise of antimicrobial resistance threatens to undermine these advances in healthcare. The fight against superbugs is a continuous arms race. As microbes evolve, scientists are working tirelessly to develop new weapons in our arsenal to combat drug-resistant infections. This involves a two-pronged approach: developing new antibiotics and exploring alternative treatment strategies. Traditional antibiotic development has slowed in recent years, but there have been some promising breakthroughs. Researchers are exploring new classes of antibiotics with novel mechanisms of action. These new drugs target essential bacterial processes, such as cell wall synthesis or DNA replication, in ways that circumvent existing resistance mechanisms. In addition to developing new antibiotics, scientists are exploring alternative treatment strategies. These include phage therapy, using viruses that specifically target and kill bacteria, monoclonal antibodies, laboratory-made proteins that target specific parts of bacteria or viruses, and antimicrobial peptides, small proteins produced by the immune systems of many organisms, including humans, that have broad-spectrum antimicrobial activity. These alternative approaches offer hope for combating infections caused by multi-drug-resistant organisms. However, significant research and development are needed to translate these promising therapies into widely available treatments. Section 5. The Roots of Resistance: Understanding the Causes of AMR. To effectively combat antimicrobial resistance, it is crucial to understand the factors that drive its development. Two primary drivers contribute to the emergence and spread of AMR: genetic mutations and the misuse and overuse of antimicrobials. Bacteria, like all living organisms, undergo random genetic mutations during replication. These mutations can sometimes confer resistance to antibiotics. If a bacterium with a resistance mutation survives exposure to an antibiotic, it can then multiply and pass on the resistance gene to its offspring. This process of natural selection is a fundamental driver of antibiotic resistance. The misuse and overuse of antibiotics accelerate the process of resistance development. When antibiotics are used inappropriately, such as for viral infections or in unnecessarily high doses, they create a selective pressure that favors the survival of resistant bacteria. Several factors contribute to the misuse and overuse of antibiotics. Overprescribing by healthcare professionals. Antibiotics are often prescribed for conditions that do not require them, such as viral infections. Patient demand for antibiotics. Patients often pressure doctors for antibiotics, even when they are not necessary. Lack of access to diagnostics. In many parts of the world, access to diagnostic testing is limited, leading to the inappropriate use of antibiotics. Agricultural use. The widespread use of antibiotics in livestock and agriculture is a major contributor to AMR. Section 6. Recognizing the enemy. Symptoms of superbug infections. Superbug infections can manifest in various ways, depending on the type of microbe involved and the site of infection. Recognizing the signs and symptoms of these infections is crucial for seeking prompt medical attention and receiving appropriate treatment. Common symptoms of superbug infections include fever and chills, a common sign of infection, indicating the body's immune response is fighting off the invading microbe, fatigue and weakness. The body diverts energy to fight the infection, leading to feelings of tiredness and lack of energy, pain and swelling. Inflammation at the site of infection can cause pain, redness, and swelling. Persistent cough or difficulty breathing. These symptoms may indicate a respiratory infection such as pneumonia. Gastrointestinal issues, nausea, vomiting, diarrhea, and abdominal pain can be signs of a gastrointestinal infection. Skin infections. Redness, swelling, warmth, pus, and pain are common signs of skin infections. It is important to note that these symptoms can also be associated with other conditions. If you experience any of these symptoms, it is essential to consult a healthcare professional for proper diagnosis and treatment. Early detection and appropriate treatment are crucial for improving outcomes and preventing the spread of superbugs. Section 7. Prevention is key combating AMR through responsible practices. Preventing the emergence and spread of antimicrobial resistance requires a multifaceted approach involving healthcare professionals, patients, policymakers, and the agricultural industry. By adopting responsible practices, we can preserve the effectiveness of existing antibiotics and mitigate the threat of superbugs. Key prevention measures include responsible antibiotic use. Antibiotics should only be used when prescribed by a healthcare professional and should be taken exactly as directed. Completing the full course of antibiotics, even if you start feeling better, is crucial for killing all the bacteria and preventing the emergence of resistance. Improved hygiene practices. Simple hygiene measures, such as frequent hand washing with soap and water, can significantly reduce the spread of infections. Covering coughs and sneezes and properly cleaning and disinfecting surfaces can also help prevent the transmission of microbes. Vaccines are one of the most effective ways to prevent infections and reduce the need for antibiotics. Staying up to date on recommended vaccinations can help protect individuals and communities from vaccine-preventable diseases. Reducing agricultural use of antibiotics. The widespread use of antibiotics in livestock and agriculture is a major contributor to AMR. Implementing policies to restrict the use of antibiotics in animals and promoting alternative approaches to disease prevention in agriculture are crucial for addressing this issue. By embracing these preventive measures, we can collectively contribute to the fight against antimicrobial resistance and safeguard the effectiveness of these life-saving drugs for future generations. Section 8. Fighting back treatment options for superbug infections. Treating superbug infections poses a significant challenge due to their resistance to multiple antibiotics. Treatment options often involve a combination of approaches tailored to the specific type of infection and the patient's individual circumstances. When a superbug infection is suspected, healthcare professionals typically perform laboratory tests to identify the specific microbe involved and determine its susceptibility to different antibiotics. This information guides the selection of the most appropriate treatment regimen. In some cases, effective antibiotics may still be available to treat the infection. However, these antibiotics may be more toxic or have more side effects than those typically used for susceptible infections. Careful monitoring and management of potential side effects are crucial during treatment. For infections resistant to multiple antibiotics, alternative treatment options may be considered. These include combination therapy, using 2 or more antibiotics simultaneously to overcome resistance mechanisms. Phage therapy, utilizing viruses that specifically target and kill bacteria. Monoclonal antibodies, administering laboratory-made proteins that bind to and neutralize specific pathogens. Supportive care, providing supportive measures such as intravenous fluids, oxygen therapy, and pain management to help the body fight the infection and manage symptoms. The choice of treatment depends on various factors, including the severity of the infection, the patient's overall health, and the availability of treatment options. Prompt medical attention and appropriate treatment are essential for improving outcomes and preventing the spread of superbugs. Section 9. A global call to action, collaborative efforts to combat AMR. The fight against antimicrobial resistance is a global challenge that demands a coordinated and collaborative response. No single country, organization, or sector can address this threat alone. International cooperation, innovation, and investment are essential for tackling this growing crisis. Several global initiatives are working towards combating AMR. World Health Organization, WHO, Global Action Plan on Antimicrobial Resistance. This plan provides a framework for countries to develop and implement national action plans to tackle AMR. Tripartite Collaboration on Antimicrobial Resistance, a joint effort between the WHO, the Food and Agriculture Organization of the United Nations, FAO, and the World Organization for Animal Health, OIE, to address AMR across human, animal, and environmental health sectors. Global Antimicrobial Resistance Research and Development Hub, a collaboration between several countries to accelerate the development of new antibiotics, vaccines, and diagnostics. These initiatives highlight the importance of a One Health approach to tackling AMR, recognizing the interconnectedness of human, animal, and environmental health. By working together, we can slow the spread of superbugs, preserve the effectiveness of existing antibiotics, and protect global health. Combating AMR requires sustained commitment and investment from governments, healthcare providers, researchers, the pharmaceutical industry, and the public. By prioritizing research, innovation, and responsible practices, we can prevent this silent pandemic from becoming a catastrophic reality.
Why do so many people with diabetes in the US swear by GLP-1? Let's break it down for the Philippines. GLP-1 medications like Ozempic and Wegovy mimic a natural hormone in your body. They help regulate blood sugar and curb your appetite, which can lead to weight loss and better diabetes control. Sounds great, right? But let's talk pesos. In the Philippines, GLP-1 meds can cost anywhere from PHP 5,000 to PHP 20,000 a month. That's a pretty big range. The price you pay depends on the brand and dosage. Ouch! So, is it worth it? Well, that depends. If you have severe diabetes or obesity, GLP-1s might be a game changer for you. But remember, everybody is different. Side effects, existing health issues, and your wallet all play a part in the decision. Always chat with your doctor to see what's best for you. Now, what about availability? GLP-1s are becoming more common, but talk to your healthcare provider to find out which ones you can get locally. Don't forget to like, share, and consult a healthcare professional for personalized advice. Stay healthy, folks. #GLP1 #diabetes #obesity #Philippines #health.